A 22 years old man having blood transfusion after losing blood from peptic ulcer. He is normally fit and well. 4 hours after the transfusion, complains sudden onset shortness of breath and chest pain. On examination, his temperature 37.2 degrees Celsius, which is normal. Saturation is 88, which is very less on air. Blood pressure 100/55, heart rate 110. So the blood pressure within normal range, but heart rate increase, so it is not hypovolemic shock or anaphylactic shock, because in anaphylactic shock blood pressure very less, so it is not the hemolytic anemia. But he has crepitation bilaterally up to the mid zone. He is given IV furosemide but deteriorates and admitted in ITU. Invasive monitoring shows there is normal right heart pressure. So what is the most likely cause of this process? Here are the options. Options are the acute hemolytic transfusion reaction, delayed hemolytic transfusion reaction, fluid overload, transfusion associated lung injury, and graft versus host reaction. So what may be the option? Here we can see in this scenario their right heart pressure is normal. That indicates as the right heart pressure is normal, so there is no fluid overload. And transfusion associated lung injury is a rare reaction causing neutrophilic mediated allergic pulmonary edema, and patient have antibodies to the donor leukocytes. It is important to consider that as it is diagnosed with patient don't respond to treatment for the pulmonary edema. Patient normally respond to supported therapy including fluid and oxygen. What are the reactions? Reactions are the immediately there may be pyrexia, alloimmunization, thrombocytopenia, transfusion associated lung injury, graft versus host reaction, urticaria, acute and delayed hemolysis, AVO incompatibility. On the other hand, the non-immune mediated hypocalcemia, CCF, that means the congestive cardiac failure, infection, and hyperkalemia. So what is our answer? Our answer is it is transfusion associated lung injury. Other options here such as acute hemolytic transfusion reaction. In case of the acute and chronic hemolytic transfusion reaction, there is the definitive low blood pressure. That means the blood pressure will reduce, and at the same time temperature will increase. So in case of the acute and chronic hemolytic transfusion reaction, blood pressure will drop and temperature will increase, but here there is no temperature increase and blood pressure within the normal range. And fluid overload is not also possible because there is the normal heart pressure. As it is normal heart pressure, that means it is not fluid overload. And graft versus host reaction, it is also not true. And here we can see it is lung injury. For lung injury there is crepitation of the bilateral lungs.